In my opinion, in the 40 odd years and over a couple thousand patients I've worked with, I believe there's an unrest that starts at an early age. So one of the questions I ask people when I first meet them is, when you were growing up at 15 or 16 and you were living at home with your parents, was it an environment that made you feel good about yourself, strong and empowered? Or was it an environment that made you feel badly about yourself and caused you a lot of depression and anxiety? So the patients that I see, obviously I see them because they're not well. Their answer is, causes anxiety, depression, and low self-esteem. So the cause of the psychology behind addiction is, I'm not a psychologist, so I can't answer that scientifically. But it's a fight or flight mentality, right? Our body puts in place psychologically and physically the things we need to survive. So for example, if you're a sober guy and you fall asleep and something happens in the middle of the night and your body wants to throw up, it wakes you up. The whole process of regurgitation and all of that wakes you up. So you'll wake up, you'll roll over. If you're high or if you're inebriated and your body wants to throw up in your sleep, you end up choking on your vomit. So when people say, the psychology of, or the science behind addiction, what causes people to end up dying, it's a physiological response, not just a psychological response. So the physical dependency on things like alcohol, heroin, on many drugs, the physical dependency is a driving factor, because once you're into it up to your nose, it's really difficult to stop, so to speak, going back to one of your earlier questions. And the solution, if you will. So the psychology is about unrest. So trauma, drama moments, abused as a child, abused as an adult, saw abuse, someone died in your arms, lost a parent, lost a dog, lost a job, lost a wife, trauma and drama moments, right? That cross between kind of PTSD, post-traumatic stress disorder, and anxiety and depression, like they all kind of get mixed up. And I'm talking about disorders that are non-chemically driven. So let me explain. Schizophrenia, bipolar disorder, borderline personality disorder, many of those disorders, as I mentioned, have a chemical imbalance that leads to the disorder, which is why medication works along with good therapy. When your person is suffering from anxiety and depression as a result of trauma and drama moments, PTSD and such, they're fixable, changeable behaviors because they're adapted through circumstance as opposed to internally through chemistry. Does that make sense? I hope I didn't lose everybody out there. So some of it's chemical imbalance. So for example, people that have eating disorders often find, other forms of mood disorders because their body's so out of whack because they're not getting the nutrition that they need, the proper vitamins and so on. Those that go through, physical change in their lives, a guy who's, one day he's 350 pounds, 10 months later, he's now 250 pounds. Sometimes that 100-pound loss can create a chemical imbalance. We see it a lot with women postpartum. After they have babies, we see forms of chemical imbalance, not permanent, but needs to be treated. Deep depression, for example, in postpartum disorder, often is a chemical disorder, so it's treated medically as well as through therapy. So it's not an easy question. What causes addiction? A lot of different things for a lot of different people. How do you treat it? Holistically and through good therapy is a given in all of circumstances, but some require medication, some require the help of medicines, if you will, that will balance the bloodstream over time so that people can get to that even place. And again, good nutrition, good sleep, good fitness, all a big part of it.